Have you been experiencing pain in your penis or in your vagina? Or have you been experiencing pain anytime you urinate? Have you taken notice of that? It might be a lot of things pointing out, or it might be creating an awareness of what is happening to you. One of the things that might happen is what we call urinary tract infection. Now let me gist you about urinary tract infection. Urinary tract infection is an infection of our genital part or our urinary system, to be specific. The urinary system comprises of the kidneys, the urethra, the ureter, and the bladder. Now, when you are having an infection in your urinary system, you'll be experiencing the question I asked earlier, that have you been experiencing pain in your genitals? And when you are having infection in your kidneys, we normally call it pyelonephritis. When you're having infection in your bladder, we call it cystitis. And when you're having an infection in your urethra, we call it urethritis. Remember, the urinary tract infection will start from a point before it develops into these individual conditions I have mentioned. And once these individual conditions set in, then we are trying to talk about what is called the complications. Now, if urinary tract infection is the infection that affects the urinary system, then what are the signs and the symptoms when I have this particular condition, or when I'm being associated with this particular infection? Now, we are going to have painful urination anytime you urinate. That is why we call the dysuria. Anytime you urinate, you feel a burning sensation in your genital. You can't even control yourself. Sometimes some people will be crying. That people will even get to hear them crying that something is wrong with this particular person. Sometimes they will have blood in their urine. That is why we call the hematuria. These people will have frequent urination. These people, when they are urinating, they can't stand. They will be running, they will be roaming about. They can't stand on their toes. They can't stand firm to urinate because of the burning sensation. They will be seeing spots of blood. They'll be feeling feverish. Sometimes they will have malaise, what we call the general weakness. These and some of the signs and the symptoms will point out to you that you are having this particular infection. The frequent urination, as I mentioned earlier, is also part of it. If you're having these signs and symptoms, then it's trying to point out to you that you are having an infection, which you have to take notice of it and find treatment to it as soon as possible. Because if you don't treat it, it can develop into a different complication, which you might not like it, which might be worse for you. Now, somebody will be asking, I don't have this particular condition, so I am free to go. It doesn't mean you are free to go. You need to protect yourself so that you don't end up getting this particular condition. Remember, if you get this particular condition and you are not able to treat it very well, it will become a recurrent urinary tract infection, which you'll be wondering about, which will bother you a lot, which will be worrying you anytime you are going somewhere or a special occasion. And that is why we all need to protect ourselves from this particular infection. How can I get this particular infection? One may ask. Sometimes the public facilities we use, especially the washrooms and the bathhouses that we use. And the washroom is very, very important. The public facilities mostly cause this particular condition. The food that we eat, the water we drink, we need to check all those things because the organism that causes it mostly reside at these particular places. So we need to. And then most of the times, especially the young people, will be sitting on the water closet or in the washroom for a very long time. At that place is where they are catching their Wi-Fi and then they are browsing over there. And remember, once you are sitting on the water closet for long, the organism will get a brave opportunity or a very good medium to get associated with you. And that is why you're going to develop this particular condition. What are the complications of it when I get this particular condition or when I get this particular infection and I don't treat it very well? Or when I'm treating it, I don't do it very well. What are the complications? As I said earlier, you get kidney infections. It will develop. Why? Because this infection starts from your private part, which is the penis or the vagina. It travels out, it travels up through the ureters into your urethra, starting from the penis to the bladder to the urethra, through the ureters into your kidney. So look at the point where I'm mentioning. Look at where it is traveling from. The route of transmission is very important. So once the organism gets to your bladder, it will infect your bladder, and that is why you get a cystitis, which is a complication of it. It can travel to your uterus, and that is why you get a urethritis. It travels to your kidney, and that is why you're going to get the renal diseases. Where the renal diseases, if you don't solve it early, as soon as possible, it can develop into the renal failure, which is sometimes some people develop end stage. People be like, hey, can UTI cause this particular thing I'm mentioning about? Yes, it can cause that. So we need to be mindful of that. We need to take good care of ourselves. Our hygiene is very, very important, because hygiene has been one of the major problems of the youth nowadays and of our children, our young people nowadays. We need to take good care of ourselves, because hygiene is one of the major things that when we get a good hygiene, we are able to protect ourselves even without taking in any medication. So we need to have a good hygiene and a good sanitation as well. When we get these particular complications, one of the complications that we can talk of is sepsis. Once you are getting these infections and you are not treating it very well, sepsis can set in. Sepsis is when you are having infection of your blood, and the infection, that is where the immune system becomes compromised. The immune system cannot get function. The immune system cannot fight against any condition. So if sepsis sets in, septic shocks will be setting in, septicemia and others will be setting in, and that is why we want to prevent this particular condition. How do we manage or prevent it without getting it? Whether I have it or I don't have. Whether you have or whether you don't have, I said your hygiene should be very key. Your hygiene plays a very good role. The first thing is we should have our hygiene insecure. Our hygiene should be very well. Your undies, the clothes you wear, the water you use to bath, your sanitation, everything should be on point. Regular changing of your undies should be on point, so that we don't get in contact with this particular condition. If I have, what should I do? And that is why you need to get your natural supplement that will help you. And that is why I'm talking about Hepaplus, Pavi, and Plasmos. That when you get this particular drugs, or this particular supplement, it will help you to combat this particular infection and you'll be free to go. Sometimes I even tell people to take in tiger nut or coconut water in addition to this particular supplement, and that will help them to cure these particular infections. That will help them to cure this particular urinary tract infection, and they'll be free to go. They can come back to this particular infection and they'll be free. Even if you don't have this particular condition, I'm recommending Hepaplus, Pavi, and Plasmos to you. Take them as your daily medication. Take them as your daily supplement for your general well-being, to boost your immune system, to uplift the work of the immune system, so that it can support the body, the general well-being of the body, fight against every infection or every hidden infection. The Escherichia coli, who is the causative organ of this particular condition, might be hidden over there, but has not given you any signs and symptoms. Thank you.